Hello everyone, welcome back to my channel. This is Dr. Precious and today we're going to discuss wisdom teeth. I get this question all the time. Even people from my home country, people have reached out to me asking, my dentist said I should take out my wisdom teeth. Is it really necessary? Why this and why not? So today we're going to break that all down. Now, not everybody have wisdom teeth. Some people may never grow their wisdom teeth and some people do. So if you're one of those with wisdom teeth, it usually will come into your mouth between the age of 17 to 25. Bear in mind, nothing is set on stone. There's always exception to the rule. You will find that 30-year-old woman that is erupting teeth every once in a while. But usually 17 to 25, they will come through your gum. It doesn't mean that's when they developed. They may have developed but stay inside your gum or inside your bone for a while before they come through, if they come through, because some wisdom teeth may stay impacted. And that impaction can be soft tissue impaction or bone impaction. That means they can develop all the way but still stay inside your bone. And some of them will develop and come through out of the bone, but still stay inside your gum. So these are the types of impaction we see. Some of them will come into the mouth, but they will not come all the way into the mouth. So it's all types of things that can happen with wisdom teeth. You may not grow it at all. You may grow it and they will be stuck inside your bone. It can be stuck inside your bone and your gum. That means it has gone through the bone, but it's still being covered by gum. And they can be, stuck partly inside your bone and gum and partly inside your mouth. That means a little part of it is speaking. So these are the types of impaction that we see in wisdom teeth. Now, when that happens, when it's not all the way inside your mouth, it could be because you don't have enough room for it. So it's trying to push through. And in this case, it might affect your other teeth. It might push on all your other teeth. It might be, laying on top of your other teeth. So it doesn't have enough room to come out and be an individual on its own. So it's kind of always attaching to everybody else. So other than the fact that it's stuck, there's other things involved. When it's stuck like that, especially when part of it is peeking into the mouth, you may have micro food particles seeping inside your gum, causing localized infection. You can have things seeping inside because there's no way for you to clean it. You basically have this tooth peeking out. You have, gum around it. So there's a little space that goes inside your body, inside that gum that you may not be able to reach. So things are seeping in there, things are getting in there, and eventually will start causing inflammation. It may eventually even cause infection. And at that point, that's how come it hurts sometimes. Some people swell up sometimes. Some people even get full infection. They have fever, everything. So this is why your dentist will usually recommend you get your wisdom teeth taken out. Once they see that it doesn't have enough room to come in and stay on its own and come in properly. So they might even recommend you take it out before it's completely inside your mouth or even before it starts picking inside your mouth to prevent further complication in the future. Because we all know the younger you are when you get surgery, the faster you can heal. Your bone is completely turning over. Your body is working all the time. But the older you get, the slower. Your bone is denser. Your healing is prolonged. You have even more chance of complications, nerve damage and things like that. The younger you are, the risk is still there, but it's lower. So that's how come your dentist will recommend you get it taken out even before it starts causing you problem, to go ahead and take it out, so you don't wait till you get much older and then it start causing problem and you now want to take it out. And by then, chances of complications have increased. That is why we recommend take out your wisdom teeth once we see that it's not coming in properly. So that's one. Another thing is, like I said before, it affects your other teeth. It may be pushing on them. It might cause crowding because it's trying to squeeze in where there's no space, causing the other teeth to also squeeze themselves, getting out of alignment. Chances of this infection is also increased because it's way in the back of your mouth. Most of the time, people don't reach it. People have a hard time cleaning the teeth they see and the ones that is very accessible, not to talk of the one that is hidden way behind. Most of the time, people don't brush it. Plaque is built up in it, food particles are stuck in it, and they will start causing problems, decay, and things like that. So that's another thing. And once if it gets decay, it's so fine, the back is very difficult to reach, to fix. So generally, wisdom teeth are usually up to no good. Now, should you take it out? It depends. Some people have enough room and their wisdom teeth will grow in and act just like other teeth. So if they have enough room to grow in, because everyone is different and you can reach it and you can brush it and it's functioning well, it's not pushing on any other teeth, it's not causing anybody any problem, it's not bothering its neighbors, then you don't have to pull it out. You can just leave it. It's actually better you leave it because you don't know what will happen in the future. In the future, you might have issue with another tooth and you still have that wisdom tooth to, to replace it, to increase the number of teeth you have in your mouth. And sometimes if you lose another tooth, orthodontists can use braces to pull that wisdom tooth into another space. So having it there can be beneficial as long as it's not causing you problem. But if it's causing problem, then the benefits is not worth it. It's better to go on and take it out because it can cause a whole bunch of issues. So if you do decide with your doctor to get your wisdom teeth taken out, be sure that you have gone to somebody who is trained, experienced, because wisdom teeth can be tricky. They are close, especially the lower ones, they are close to your nerve. The lower ones are close to your inferior alveolar nerve. It's a nerve that runs through, is a very important nerve. If you go taking it out and you touch that nerve or you hurt that nerve, that person may not have feeling in one side of their face. So, they may have issues, nerve issues in the future. It's good to make sure that you're with somebody who is experienced and who can take it out very carefully and very successfully. And the top ones, you have your sinuses. Right here is called your sinuses. Is actually a hole. If you see your bone, there's a hole there. And that tooth, the root of that tooth usually can be close to that sinus. And if care is not taken, the sinus can be perforated, and that could be another complications. What am I saying? Because I know I have people that watch this from other countries. Make sure you're going to somebody who is licensed and somebody who know exactly what they're doing, because it can be complicated. People have passed from taking out wisdom teeth if due to complications that can arise afterwards. It's very rare, but it can happen. So be very careful. Make sure you're going to somebody who is trained and who is licensed and who know what they're doing to take out your wisdom teeth. Maybe in another video, I'm going to share my own experience because I actually had my own wisdom teeth taken out, and trust me, it wasn't funny. So maybe I'll make another video and tell my own wisdom teeth journey. But anyway, thank you for watching. If you learned something from this video, don't forget to share with a friend and subscribe for more. Until next time, God bless you. Bye.